I know that Ebola has become a very big news item, and there's concerns even when we were there of it, how it was tracking from Guinea. Can you tell me the status of it and what you are doing in your hospital to address that?
We started first with the presence of John Sampson from Johns Hopkins, where we sat together and decided to do education of our staff and just basic things, universal precaution, hands washing, and went into the community and educate the community to be the first responder, so that if they see these signs and symptoms, call the hospital and we will have people there and see how we can isolate these people and do a proper assessment, and based on the assessment determine whether it's Ebola or is just ordinary diarrhea, or if it is Lassa fever and so forth, because Liberia is on the Lassa fever belt. In Monrovia and other places where there is concern, the education has not been so much, but from our standpoint, I think we've done everything. We've tried to get enough protective gear so that the healthcare provider cannot expose themselves in the process of helping others. You have to protect yourself first, make sure you are safe, then you can provide that. And I think this is the message we are sharing with our staff and gradually sharing with the people of Liberia.
So we did a tour of a partially constructed site outside the boundaries of your walls.
That is right.
The site. How has that come along?
What we did was that instead of just training people, we have to have an isolated area. So the site that you saw is our isolation unit. It is completed. It has 8 rooms, and those rooms are individual rooms, so you can have about 8 patients in there and they won't be in contact with each other. They have their own restroom and everywhere, and there's a small nursing station that we built, which should also protect whoever is providing service to them and not to be exposed, and they will be in their protective gear and so forth. So we have that building has been completed. Fortunately for us, we have not had a confirmed case of Ebola at the Jackson Hebdo Hospital. We've had more than 5 suspected cases, and samples that were sent out came back negative. So for now, we are keeping our fingers crossed.
Yeah. But it's so encouraging to see the amount of preparedness you have put in place so that you do protect your staff, and not just your staff, their families, and all the people of that hospital.
That is so true.